Good afternoon and welcome to the October session of Healthy Living Together. A few housekeeping items before we begin. As you enter, your audio will be automatically muted. Please use the Q&A function at the bottom of your screen to ask a question. This event will be recorded and a link will be sent to you in a follow-up email. Today's topic will be Medicare and Medicaid, and we will reserve some time for questions and answers at the end of the presentation. My name is Ashlyn. I am the Great Start Collaborative and Parents as Teachers Director in Sanilac County, and I will be serving as your host today. The presentation will be provided by Alecia Parks. Alecia is a licensed Master's of Social Work and currently serves as a social worker and Medicare Navigator at McKenzie Health Systems.
All right, let's get started. All right, good afternoon. Thank you for taking the time to attend this brief overview to learn some of the basic information about Medicare, Medicaid, and Marketplace. My name is Alecia Parks, and I am one of the social workers here at McKenzie Health System. I'm also a trained navigator, and I assist people with concerns they have regarding any of their healthcare coverage needs. The objectives for our session today is simple. This is a very complicated subject matter, and so I'm just trying to keep things simple and want to teach you some of the basics regarding these three different insurance programs and where you go for help and for questions. I thought it'd be a good idea to start off with some key terms and definitions. I started working here at McKenzie in March of this year and had an opportunity to receive some training on these different topics and realized that a lot of these key terms can be confusing and overlapping. And so just some general definition. So premiums are the payments we make every month to maintain coverage. So when it comes to private insurance and Medicare Part B, we pay monthly premiums. Copay. A copay is a fixed amount someone pays for a covered healthcare service. Coinsurance is our share of the cost of a covered healthcare service. It's different from a copay because it's a different percent of the total allowed amount for the service, not a set dollar amount. A deductible is a dollar amount that we must pay for healthcare services before our plan will start paying for our care. So we have to meet that amount. And then there's an out-of-pocket limit, and that's the maximum amount that we are responsible for paying on our health insurance each year. The first coverage that I wanted to talk about has really been a hot topic over the last several months, and I'll share with you why that is. So Medicaid, I often say, I'm not sure who made the decision to title these two insurance programs so close together, but Medicaid, there's a picture of what a Medicaid card looks like on the slide. 86 million Americans have Medicaid. It is the single largest source of health insurance coverage in the United States. This is the information I wanted to share with you. As of April 1st, 2023, 30% of people in Michigan were on Medicaid. That is 700,000 more people than there was before the pandemic. The Michigan Medicaid healthcare program is intended to provide medical and health-related assistance to low-income individuals and families who have no medical insurance or have inadequate medical insurance. To be eligible for Medicaid, someone must be a resident of the state of Michigan in need of health care and insurance assistance meet a certain financial situation characterized as low income or very low income. Different states have their own type of Medicaid system, but to obtain this type of Medicaid, you need to live in the state of Michigan. So what you should know. So oftentimes I receive phone calls here at the hospital. People will say, hey, I need help applying for Medicaid. And I will ask them some questions and collect some information to see if maybe they would qualify. By no means am I a state employee. I don't do, determinations or anything like that. So Medicaid is an eligibility program. And for each application, there's different qualifications. So there's Medicaid for mothers and fathers of young kids. There's Medicaid for disabled people. There's Medicaid for people who live in nursing homes. So each application's different. So it's not a one size fits all black and white response when people contact me. There's other plans too, based on income, like My Child and Healthy Michigan Plan. Medicaid is income-based. So how much money you make. We found a 2003 income poverty guideline chart there. It's just a basic reference. It's not written in stone. But that chart there kind of illustrates for you some of the income limits to qualify for Medicaid. There's asset limits. Some of those asset limits are, only having a set amount in your checking and savings account, not owning more than one home, and certain parameters regarding a life insurance policy. So when you apply for Medicaid, there's no special enrollment period. It's not like other insurance programs. Applying for Medicaid can happen anytime throughout the year when it's appropriate. Medicaid also offers retro payments. So if I have an individual who comes into the hospital today, October 18th, and they don't have any health insurance, and I think I might be able to get them qualified for Medicaid, I can help them apply for Medicaid today on the 18th. And they won't necessarily get a determination right away. It can take up to 45 days. So if in that 45-day time frame they get approved, the Medicare will go back and pay up to 3 months before October 18th. So it'll cover any of that once we complete a retro application. It also, Medicaid pays for the Medicare Part B premiums that we talked about, and we'll talk about that a little bit more in future slides. How to apply and where to go for help. Something I just realized that I didn't put on here is for people that aren't really sure, typically elderly people or disabled people that might go into a nursing home who aren't really sure about their assets and their income and their savings accounts, they should meet with an elder law attorney. And I'm able to give referrals to those if you contact me. Those types of situations I don't necessarily get involved with because there are some legalities and things, some safeguarding things that people need to do. And most attorneys, most elder law Medicaid attorneys will meet with somebody for free for the initial visit. So how to apply if you were doing it on your own is you would go to this mibridges.gov website. You have to create an account and you can apply everything online. And you have to have an email address. That's something new that they've created since the end of the pandemic. So you have to have an email address, a username, and a password and set up your account. I have had some people tell me they've had success applying through the helpline, and the number is up there to the Michigan Healthcare Helpline. And then, of course, you can contact me here at McKenzie Health Systems. I tell people You don't have to be a patient of any of our providers. You don't have to come into the hospital to use our ER services or have surgery here or any other outpatient type service. But I will always help you. And I always encourage people to share that with your friends. So I'm here Monday through Friday, 8 to 4:30, typically. And if you call me and you set up a time, we can actually get together here at the hospital and I'll help you apply right here step by step. So this is a good time to bring in, like I was saying at the beginning, about some changes that have been going on. So during the pandemic, the government declared us to be in a public health emergency. So during that time, up until April 1st, individuals and families were able to be on Medicaid and they didn't have to do this redetermination process. They didn't have to annually see if they qualified. So starting in April, they started notifying people and letting them know. And as of July 1st, we have started to see our first group of people that no longer qualify for this type of insurance. This process, so if you have Medicaid or someone that you know has Medicaid and you have not been notified of anything, this process does continue until May 31st of next year. So eventually they are going to, review everybody's case to see if they still qualify. So we're seeing influx of individuals who no longer qualify and need some help with other options. So some of the things that the state is encouraging people to do is make sure that you create that account at mybridges.gov to keep your address and phone number updated, because they're not going to be able to notify you if they don't know where you're at. And if they can't notify you, they will just close your case if they don't get in touch with you and don't get updated information. And also at that website, you can update who lives with you, if you've had any babies, any changes in the dynamics in your household. And they also encourage you to check your mail often. Everything isn't always online. They do send notices. And I always tell people, make sure you respond immediately, because they don't give you a lot of time to respond back sometimes. And we don't want you to be in a situation where you don't have coverage or you have a lapse of coverage. The next topic that I want to talk about is Medicare. Medicare open enrollment started on October 15th, so just a couple of days ago. I've been getting a lot of phone calls, just inquiring with some basic questions. And so this is a perfect time to be sharing this information with individuals. And like I said, I'll try to keep it as simple as possible. So Medicare is a federal health insurance program. Some individuals pay into it. Some individuals are provided this type of coverage because of a disability. So the people who qualify for Medicare are people who are 65 and older. And certain younger people with disabilities. I had shared with you that some individuals who are on Social Security due to disability, after they're on for 24 months, they can qualify for Medicare insurance. And then Medicare is also for people with end-stage renal disease, which is a permanent kidney failure requiring dialysis or a transplant. Sometimes you'll see the initials ESRD. And I put a picture of what a Medicare health insurance card looks like. So what should you know about Medicare? So I pulled the information for this presentation from the Medicare.gov website and this book that everybody should have received in the mail that gives updated information on Medicare coverage in the upcoming year, which I just read last night online that they are increasing the Part B premium. So I will see if I can find that and tell you what that is. So what you should know is that in 2002, Medicare provided health insurance for 65 million people. It also was a program that was created in 1965. Original Medicare is divided into 3 different sections. Those sections, as I'm sure you're familiar with, are Part A, Part B, and Part D. Part A, or hospital insurance, helps cover inpatient hospital care, skilled nursing facility care up to 100 days per benefit period, 60 days in between benefit period before you can qualify again, hospice care and home care. Part D helps cover services at your primary care provider's office, outpatient care like labs and x-rays, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and many, 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 I didn't even realize, preventative services like screenings, shots, vaccines, and yearly wellness visits. The cost of Part B in 2023 was $164.90, and that premium comes right out of your Social Security check each month. And I read something last night online, and I should have updated it. I believe that this year that amount is going up by $7. And if anybody has any questions about that, I can find out for sure. Now, sometimes people choose not to take the Part B coverage, and I just want to make sure everybody knows that if you choose not to take the Part B coverage when it's first offered to you, there could be penalties if you decide someday that you do want Part B. You can delay it if you have insurance through your employer with no penalties, but you must enroll within 8 months of the date that you quit working to make sure you don't get the penalty. So if you sign up for Medicare and you choose not to keep the Part B coverage, where I said it's like doctor's visits and screenings and stuff like that, and pay the $164.90 in 2023, you could have penalties if later on down the road you decide that you want to get that coverage. So it's just important to know. Part D helps cover the cost of prescription drugs, including many recommended shots or vaccines, and you must enroll in this as well. You can add Part B, which is a Medicare drug coverage. It's not automatic. Yep, that's what I was going to say. With straight Medicare, you can use any doctor or hospital that takes Medicare anywhere in the United States. It doesn't typically handle any type of healthcare coverage while you're traveling outside of the United States. Now, there's different caveats and things to that, but typically straight Medicare does not cover when you're out traveling outside of the US. You may want to prolong your enrollment if your employer is providing coverage. Yep, we talked about that. The center, okay, this was something I found interesting. The Centers for Medicare and Medicaid regulate and govern the program, but Social Security is who determines eligibility and handles enrollment. If you aren't eligible for premium-free Part A, which I'm not entirely sure who isn't, and you don't buy it when you're first eligible, that's what it was. If you aren't eligible for premium-free Part A, and you don't buy it, your monthly premium could go up 10% once you do enroll into that program. So you'll have to pay a higher premium for twice the number of years you could have had Part A but didn't sign up. And they gave an example in the book. If you're eligible for Part A for 2 years, but you didn't sign up, you'll have to pay a 10% higher premium for 4 years. So it's just important that you talk to somebody like myself, because there could be some penalties if you choose not to enroll. Let me go back here. So when can you first sign up for Part A and or Part B? It's a 7-month period. So it begins 3 months before you turn 65. It includes the month that you turn 65 and ends 3 months after that month that you turn 65. So it's a 7-month period of time. So anytime in that time frame, you can start working on this and making the decision if you're going to not be at risk of having any of these penalties. If you choose not to sign up for Part B coverage when you become eligible, you will pay a late enrollment period for that too. The Part B premium may go up 10% for each full 12 months in the period that you could have had Part B but didn't sign up. Same thing with Part D. If you don't sign up, there could be different things that could happen as far as penalties. And something to know, generally, you'll pay these penalties for as long as you have Medicare. So if you miss the enrollment period or whatever, and you have a penalty, it could be a penalty that you pay for the rest of your life. Let's talk a little bit more about Medicare Part A. So it covers inpatient care in a hospital, just like McKenzie. Inpatient care in a skilled nursing facility. McKenzie also offers a swing bed program that is covered through Medicare Part A. And that is for therapy, should it be post-surgery or due to weakness or an illness. And you pay nothing for the first 20 days. We'll talk more about Medicare Advantage plans because you may be charged a copay during those first 20 days. And then after those first 20 days, you're in charge of 20% of days 21 through 100. So you are in the hospital, you have a surgery, you have a 3-day qualifying stay, and you go to rehab, whether it be at McKenzie or a skilled nursing facility. The first 20 days are paid for 100% through your Medicare, original Medicare Part A. And then you have a 20% copay for days 21 to 100. It covers hospice care and it covers home health care. You do not pay any monthly premiums, but you have co-payments, co-insurance, and deductibles. And these may be different if you have Medigap coverage, Medicaid, or employee coverage. I don't know if I say this somewhere else, but I want to make sure that people know when you're told that you have 100 days of covered skilled nursing facility therapy does not mean that you automatically get 100 days. The 100 days is based on need. If the individual is still showing improvements, then we approve for more days or we ask for approval for more days. But if a person isn't improving or they're back to their baseline, then they'll be discharged before those 100 days are up. So you're not guaranteed 100 days. Very rarely do I see somebody use all 100 days. Medicare Part B. Medicare Part B, it helps cover medically necessary doctor's visits. So when we have a cold or an infection of some sorts, outpatient care. So if you come to the hospital for any of our outpatient services, home health care services, durable medical equipment, diabetes equipment supplies, and therapeutic shoes. The cost of a 1-month supply of insulin is capped at $35. Those were some of the changes that they made over the last 2 years. It helps cover mental health services, many preventative services, and ambulance services. The monthly premium in 2023 is $164.90, and this is taken directly out of your Social Security check. But as I said, I think that's going up by about $7 in 2024. Let's talk briefly about standard Medicare Part D. So Medicare drug coverage helps pay for prescription drugs you need. It's optional and offered to everyone with Medicare. You must live in the service area of the plan that you want to join and be lawfully present in the United States. So if your family member lives in California and they like their Medicare Part D service, that does not mean that it's going to be ideal Medicare Part D coverage in Michigan. Your drug costs will vary based on the plan you choose. Plan coverage and costs can change every year. Most drug plans charge a monthly fee that varies by plan, and you should review this plan every year during open enrollment, which is right now, and make changes if you need to. So I thought I would share a little bit and hopefully not make things super confusing about the different phases of Medicare Part D, because I know everybody on here has heard the term of a donut hole. So the first phase of Part D coverage is you have to meet a $505 deductible. Then you must pay co-pays and co-insurance up to $4,660 a year. Once you've met that $4,660 on drugs, including your deductible and everything else, you'll pay no more than 25% of the cost of the prescription out of pocket until you spend about $617 a month. Phase 4 is once you've met this out-of-pocket expense, which is $7,400 for the 2023 year. Then after that, you will pay approximately $4 for a generic medication and $10 for a name brand. So I tried to make that simple, but it's not always simple to explain like that. And that's why I'm on here, so you have somebody that you can contact when you have questions and concerns. Let's talk briefly about things original Medicare does not cover. Most dental care, eye exams for prescription glasses, dentures, long-term care. Many people ask me that question all the time. They think that it does cover long-term care, and it does not. It covers skilled nursing care just for rehab with the plan to discharge. It doesn't cover cosmetic surgery, massage therapy, routine physical exams. It does cover annual, like preventative type exams, and it doesn't cover hearing aids or exams for fitting them. So now let's talk about Medicare Advantage. I hear a lot of people tell me that they're receiving a lot of phone calls and stacks of mail over the last month or two with the Medicare Advantage plans. And so I'm going to talk briefly about that. This is also known as Medicare Part C. So that's where the rest of the alphabet comes in. It is a Medicare approved plan from a private company. It's a bundled plan that includes parts A, B, and D, and it has to meet the standards of original Medicare and what is provided. Typically, you can only use doctors that are in the plan's network. So with original Medicare, you can go anywhere that takes Medicare insurance. With an Advantage plan, you need to make sure that all of your doctors and specialists and hospitals take that Advantage plan. In many cases, you need to get approval from your plan before it covers certain drugs and services, so you might need some prior authorization. Now, the big draw for many individuals that I meet with who are considering getting an Advantage plan is that some of them offer extra benefits that original Medicare, because we just talked about it, doesn't offer, like vision, hearing, and dental services. But the plans must cover all medically necessary services that original Medicare covers. So let's talk about the Medicare Advantage enrollment. So initial enrollment period, when you first become eligible for Medicare, you can join a Medicare Advantage plan right away. General enrollment is going to be January 1st to March 31st. And open enrollment is the same as it is for original Medicare, which started this past Sunday, October 15th, and will go until December 7th. During this open enrollment time right now, you can join, switch, or drop any Medicare Advantage plan, switch from original Medicare, review your Part D coverage to make sure that the coming year that's still going to cover your prescriptions. But the key thing, and why I put it in capital letters, is that I want you, unless you're certain what you're doing, talk to someone before you make any changes. You need to do your homework when it comes to the stuff people are mailing you and what they're talking to you about on the phone, because sometimes if it sounds too good to be true, you know the rest of the story. So let's talk about Medicare supplemental insurance. So remember, we talked about co-payments and co-insurance, and if somebody goes into a skilled nursing facility, the first 20 days are covered 100%, but days 21 through 100 comes with a 20% co-pay. You can purchase Medicare supplemental insurance. It's also called Medigap. They're the same thing. Original Medicare pays for a lot, but not all of everything. Medicare supplemental insurance is sold by private companies. So I will see people who come through with insurance through Blue Cross Blue Shield, AARP, and several other companies. And the point of this is to help pay for those extra healthcare costs like co-payments, co-insurance, and deductibles. You must have Part A and Part B before you can purchase a plan. You pay the private insurance company a monthly premium for this Medigap, plus your monthly premium for your Medicare Part B. The best time to buy it is during your Medigap open enrollment period. Each open enrollment, you can review your plan and make changes if desired. As of, I wrote myself a little note, January 1st, 2020, there are 8 different Medigap plans to choose from. Oh, good. Open enrollment. So open enrollment for this, you can first sign up for Part A, Part B. We talked about that, that 7-month period. October 1st, they're encouraging, that's probably when you guys started getting the phone calls and the mailings to start comparing your coverage. There's a website I put on there that I often use when people contact me, medicare.gov/plan-compare. Anyway, if you go to Medicare, they'll take you to this website if you search it. But you're able to get on there and compare different plans to see what meets your needs, and it'll tell you how much it will cost and the ins and outs and the pros and cons of each of them. October 15th through December 7th is when you change your Medicare health or drug coverage. And then the changes go into effect January 1st. There's the website, medicare.gov. You can go there, and if you're comfortable with navigating the system, that's what I utilize when I'm helping people out. You can search things. They have easy toggle buttons for you to choose to navigate the system. You can call Medicare directly. I've not had anybody tell me any good success stories with doing that, but that's always an option. And then, of course, contacting me, my phone number listed, to be able to come in and for us together to go through the Medicare.gov website and compare things and see if there's a better option for you. I thought I'd throw in some basic insurance rules, things to think about, because I don't think I knew these things before I came to work here. So you can have Medicare, Medicaid. So you can have Medicare and Medicaid be like your supplemental insurance. I mean, it's not because you don't purchase it, but Medicaid does pay that 20% copay that Medicare doesn't cover. You cannot have a Medicare Advantage and a Medigap coverage. That doesn't work like that. Medigap coverage or supplemental insurance is for original Medicare. You can't have a Medicare Advantage and a Medigap. You cannot have Medicare and a marketplace plan, which we're going to talk about marketplace now. You can't have both of those, but you can have marketplace and Medicaid. So let's talk about marketplace really fast. Private insurance people can purchase, I'm not sure what I put there, but anyway, marketplace is a private insurance program where people can purchase healthcare coverage, and it has to comply with the Patient Protection and Affordable Care Act. Affordable Care Act is also known as Obamacare. Many of us are familiar with that. And so it was first created in October 1st, 2013 to assist uninsured people with purchasing affordable healthcare coverage. In that first year of 2013, 8 million people enrolled, and there's currently 11.4 million people who have signed up through the health insurance marketplace. So the population of people that get a marketplace Private insurance are individuals that don't qualify for Medicare and individuals who make too much money for Medicaid. Yes, I believe that's right. So what you should know about Marketplace. All Marketplace plans must cover, not much, outpatient care, treatment in a hospital, care before and after a baby is born, mental health and substance use disorder services, prescription drugs, lab tests, preventative services, vaccines, and pediatric services tailored to the needs of children to ensure they grow up and develop properly. So the plans that the private insurance companies create have to cover these basic things. They might cover more, but these basic things have to be included in all of them. So why, if you don't qualify for Medicare and you don't qualify for Medicaid, why is it important to get healthcare coverage? So I was talking to somebody and they put it this way. Was there ever a time you thought you should go to the doctor or the hospital and you did it because you didn't have health insurance? Did you know that 4 out of 5 people who enroll in a Marketplace account can find a plan that's less than $10 a month? There's also financial assistance for those who qualify. So there's different programs that help people afford these things. And I've even heard that after Medicaid redetermination that there might even be plans that almost cost $0. If you go to the hospital, most Marketplace plans are not retroactive. So why is it important to get this insurance before you need it to go to the hospital? Because back to that example I gave before, if you come here to McKenzie Health System on October 18th, you don't qualify for Medicaid, but you want me to help you apply for coverage through the Marketplace, it doesn't necessarily pay for any previous visits that you might have had. Some of the programs for financial assistance, I wrote little notes over here about, it's kind of confusing. So like I said, this next page, I'm going to encourage you to call me so I can talk to you a little bit more about premium tax credits and cost sharing reductions. So enrollment for Marketplace and where to go for help. So open enrollment for this is not until November 1st. So only a couple weeks after Medicare open enrollment, and it ends January 15th. A special enrollment period is for people who got married, divorced, lost a job, are having or adopting a baby, or they lost their Medicaid. So those people who did the redetermination after the public health emergency, they lost their Medicaid, they can contact me and I can help them with a special enrollment period right now to see about a Marketplace account. They can also, if you feel comfortable doing so, go to the healthcare.gov website, navigate the system to compare different plans. Navigator, I'm a navigator. Marketplace also has a call center. Their number is there. You can contact them, ask questions, and they might be able to find you account or coverage over the phone. But you can always contact me here at the hospital to schedule a time to come in and we can go through that system together. And like I said, don't feel like you have to be a McKenzie service user. If you just want to think of me as someone to help you with any insurance questions, you can always contact me. So my last slide is just my contact information. You can give this information out to anybody. If you're not somebody that is necessarily needing help with any of these things, you can give this information out. I'm located right here at the hospital in Sandusky, McKenzie Health System. There's the address. That phone number, that 810-648-0580 is my direct number, so it will come right to my phone. You don't have to go through rigmarole getting a hold of anybody else. And, you know, in this day and age, if for some reason you want to email me, you're able to email me. Can't share any protected health information, but I can give you some basic information over that or schedule an appointment that way. So that was the end of my presentation. I enjoyed myself being able to pull this together and think that I can help some people out with these things. Now let me see how I share my screen, guys. I'm not sure. Well, do we have any questions for me?
Alecia, there were just two questions that had come up at this time, but if there are more questions as we go, I will read them out. So the first question was, if someone doesn't meet all of the eligibility requirements of Medicaid, would you still recommend applying?
My experience is no. And why I say that is when I have met with attorneys in the past, they said that when people who aren't meeting all of those eligibility requirements apply for Medicaid, it causes them to have to do more legwork. So if you apply for Medicaid and you didn't qualify and you got denied and you have to hire an attorney to help you get qualified, you just cause the process to last a lot longer. And so that's why I always encourage people who aren't really sure or people that for sure don't meet the requirements to meet with an attorney first. I take the slam dunk cases, the ones that I know for sure that they can qualify for Medicaid. Those are the people I help out. The other ones that I'm just like, we better not monkey with this. You can get a free consultation from an attorney, elder law Medicaid attorney.
Wonderful. And then the second question was just to clarify whether there was a fee for your services or if that is free for anyone in the community to utilize.
Oh, that's a great question. So, my services are free. I was actually going to share a couple of resources real quick. I forgot. So, I was trained to understand these health insurance options with the support from the Thumb Community Health Partnership and with the Medicare and Medicaid Assistance Program, or MMAP. And they train me and they make sure that I have the resources I need to be able to share and support with other people in the community. So me answering the phone, me meeting with you one-on-one doesn't cost anybody a penny. We don't even bill their insurance.
Wonderful. I would like to give it just a few more seconds to see if any other questions come through. Okay. Well, with that, if there are no more questions, then that would conclude today's segment of Healthy Living Together. So thank you so much, Alecia, for apologies, for your presentation. It was very informative. The next session will be held on November 15th and will be a discussion on sleep, the best ways to get what you need, and easy home workouts.
Thanks for having me.